Dear students, welcome back. In this session, we are going to discuss about pancreas. Pancreas is a soft, lobulated, yellowish gland which is situated on the posterior abdominal wall, extending obliquely from the concavity of the duodenum on the right side, okay, and to the hilum of the spleen on the left side. Okay. If you see the extension of this pancreas, it can be observed from T12 to L3 vertebrae. Okay. And if you see the shape, it is elongated and the shape is a J-shaped and also retort shaped. Okay. And if you see the size, okay, it is about 14 centimeters. The subdivisions, if you see in the pancreas, it is expanded right end, okay, and it is called as head of the pancreas. Okay, next to the head, a constriction is present, that is neck, which connects the head with that of the body, which forms the main part of the gland. Body is the main part of the gland. At the left end, the body ends in a tail. Okay, these are the subdivisions: head, neck, body and tail. And the length is about 14 centimeters. Now we will see the relations. The head has two surfaces. The head has two surfaces. One is anterior surface and the posterior surface. This is the head. Here you can see the head part of the pancreas. It is having anterior surface and posterior surface. Now we will see the relations on the anterior surface. It is related to first part of the duodenum, transverse colon, and also it is related to the jejunum. It is related to the jejunum. And then and it is also related to the superior mesenteric vessels. Okay, if you see on the posterior aspect, it is related to the bile duct, okay, and also inferior vena cava and right crus of the diaphragm, left renal vein and the aorta. So these are the relations on the posterior aspect of the pancreas. Now we will see the neck part. So the neck is also having anterior and posterior relations. So on the anterior side, it is covered with peritoneum, and it is related to the lesser sac of the peritoneum, which separates it from the pylorus of the stomach. So that one is the relation on the anterior side. Whereas on the posterior aspect, it is related to the superior mesenteric vein, splenic vein. So the superior mesenteric vein and splenic vein forms the portal vein. So these are the structures related on the posterior aspect of the neck. Now if you see the body, so it is having anterior, inferior and posterior relations. So normally this body is having, if you cut in sagittal section, it is having three surfaces: anterior, inferior and posterior surfaces, and also three borders. One is superior, anterior and inferior borders. Okay, now we will see some of the relations on the anterior surface as well as the inferior relations of the body. The anterior surface is covered with the peritoneum and forms the stomach bed. It is related to the posterior surface of the stomach, from which it is separated by the cavity of the lesser sac. The inferior surface is also covered with peritoneum. It is related to the duodenojejunal flexure, okay, jejunum, and also left colic flexure. And root of transverse mesocolon is also related to the anterior and inferior relations of the body. Now we will move on to the relations on the posterior surface, and this surface is not covered with peritoneum, and it is related with the abdominal aorta, okay, and also superior mesenteric artery and the abdominal aorta, okay, and lower half of the anterior surface of the left suprarenal, middle of the anterior surface of the left kidney, and also left renal vein. Here we can see the left renal vein, and splenic veins also related to this one, and also inferior vena cava. So these are all the structures which are related on the posterior aspect of the pancreas. If you see the tail part, the tail of the pancreas passes between the layers of lienorenal ligament and slightly movable, and the tail is related to the visceral surface of the spleen, which is close to the lateral end of the hilum. Okay. If you see the duct system of the pancreas, so there is a main pancreatic duct inside the posterior part of the pancreas. It starts from the tail end and runs towards the head, receiving tributaries at right angles. It receives the tributaries at right angles and become larger in size. It joins common bile duct. So here you can see it joins the common bile duct to form ampulla, and ampulla of water, which opens into the posterior-medial wall of the second part of the duodenum. So this is about the pancreatic ducts. If we see the blood supply and lymphatic supply and all, so the blood supply is mainly supplied by the branches of inferior pancreatico-duodenal artery, okay, that is one. Another one is superior pancreatico-duodenal artery. These are the main arteries which supply the pancreas, and also gastroduodenal artery, which is a branch of hepatic artery, and also the inferior artery, which is a branch from the superior mesenteric artery. So here you can see the superior mesenteric artery. So these are all the arteries which supply to the pancreas. And the body and tail of the pancreas, so these are the supply for the head. Earlier I have discussed. So the body and the tail of the pancreas are supplied by number of branches which are arising from the splenic artery. Okay, number of branches which are arising from the splenic artery. Okay, this is about the blood supply. If you see the venous drainage is brought about by the corresponding veins which ultimately end in the portal vein. So those are inferior pancreatico-duodenal vein, superior mesenteric vein, and superior pancreatico-duodenal vein, portal vein, and the splenic vein. The same arteries which are associated with these veins. If you see the lymphatic drainage, the lymphatics from the head and neck. So lymphatics from the head and neck of the pancreas course towards the right side and end in pancreatico-duodenal nodes. duodenal nodes. It is of anterior and posterior pancreatico-duodenal nodes we can see here. The lymphatics of the body and the tail run towards the left side and end in splenic nodes. They end in splenic nodes situated at the hilum of the spleen. So this is about the lymphatic drainage. If you see the nerve supply, it is by autonomic flexes of nerves, which are also accompanying with the arteries to the supply of the organ. The sympathetic fibers are derived from the lower thoracic segments of the spinal cord, while the parasympathetic are supplied by vagus, and lower thoracic segments of the spinal cord and the parasympathetic fibers are from the vagi, both right and left side vagus. Okay, this is all about the pancreas. Thank you.